Yeah. Thank you all for being here today. It is not often that three leaders from different hospitals hold a media briefing. Akram Boutros is the president and CEO of the Metro Health Medical System, and Dr. Cliff Magarian is the president of University Hospitals. We're entering a critical time in Northeast Ohio related to the COVID-19 pandemic, and therefore we need your help to get these important messages out to the public. COVID-19 cases in our region and state continue to rise at alarming rates. Looking back to the start of the pandemic, much of the world was on a stay-at-home order. That is not what we face today. What we face is perhaps the most sobering situation during this pandemic. It is a turning point in the truest sense, and the power to do what is right is now in the hands of each member of every community. We know how to better treat this disease through innovative therapeutics. However, if we continue at the rate we are going, our hospitals will be overwhelmed. Across our region, we have enough beds and supplies to care for our patients. Our concern is our caregivers. We need everyone to do their part to protect the healthcare workforce as we navigate through this pandemic. Today, here at Cleveland Clinic, we have more than 450 patients hospitalized in our Northeast Ohio hospitals. We're averaging 60 new COVID-positive patients admissions per day. Never before have we had this many caregivers out of work sick, currently more than 800. Yet our communities need us now more than ever. In order to do this, we need everyone in our communities to do the right thing. Akram is going to share with you what Metro Health System is experiencing and a few important reminders as we head into the holiday season. Now I turn it over to Akram.
Thank you very much, Tom. In the past week, the number of calls to the free COVID hotlines are the highest we've received since March, which means a lot of people are getting exposed and are concerned. That and the increasing test positivity rates, which are now nearly 1 out of 4 people tested in our emergency rooms and clinics, have resulted in a dramatic increase in hospitalizations and the number of employees who are becoming infected. And this is just the start of the surge. This reminds me of my work in New York City during the height of the AIDS epidemic, where we learned that unprotected contact with one person means you are having unprotected contact with dozens of people you don't know. The same holds true with this virus. Your nephew comes over for a Thanksgiving dinner, but you're not just in contact with him, you're in contact with all the people he's been in contact with and all the people they were in contact with over the past 2 weeks. As for our healthcare workers, contact tracing shows us that they are not getting infected at work, but instead when they are out living their lives. And if we have many of our staff out because of exposure, while there's a large influx of COVID patients, we will not be able to provide the best care to everyone who needs it. So I'm asking you, everyone in the community, to be even more vigilant about washing hands, watching your distance, and wearing a mask. Look, there is a light at the end of this tunnel. Last week and this morning, we received very encouraging news about a vaccine. I am confident we will be immunizing people in early 2021. In the meantime, we need your help to stave off a crisis for a little while longer until the vaccine is available. Please stay vigilant and please stay protected. Now it's my pleasure to introduce Dr. Cliff Magarian.
I want to make sure that I echo that of my two colleagues, Tom and Akram, that University Hospitals is similarly experiencing changes with regards to our experience with COVID, much worse, nearly 100% worse, if you will, than we did during the first phase. And I think there's no doubt about it that the primary ingredient behind that is the ability for people to move around, get around, and gather into small groups. At UH, we have just about over 200 inpatients at this time spread amongst our 18 hospitals, and we're getting 25 to 30 new patients a day. We have just about 200 or so of our staff, our amazing staff, who are sidelined with the virus at this point. So obviously that challenges our ability to continually absorb more and more patients, but nevertheless, we feel confident with our colleagues that we will together be able to do this. I think it's important to recognize that despite the potential good news of a series of vaccines, one of which we're trialing here, that we need to realize that before this happens, before there is vaccines to the public, we have a bunch of crucial months over the holidays whereby people will be gathering. I think, make no mistake, I want to make sure people who are listening understand that we believe, and I think I speak for Tom and Akram, that we believe our hospitals are safe. Oftentimes caregivers are getting the virus through community spread, and our patients certainly who are coming to us are getting it through community spread rather than spreading at our facilities. We use the latest techniques to make sure that we are protecting our patients and our caregivers. Clearly, masks work. I want to make that very clear. Masks work. We want to dispel the myths, but I'm seeing things, and I think we're all seeing things. Sometimes people are not wearing masks, whether they be gatherings of people who don't normally work together or be together, whether it be at a restaurant or a gathering or at a gym. And we're also seeing people are not properly wearing masks. You're seeing the nose exposed. We have to encourage each other in the nicest way to rid ourselves of that habit. And when folks are getting together into large groups, I think at times there's a level of ease that comes with familiarity, but doesn't mean that the groups are indeed clean or clear of the virus, and thus we're seeing the spread. I think we need to work together to make sure that we are the educators and we help people make the right decisions. I agree wholeheartedly with Akram that unlike in March or April, the notion of there being a potential new way of preventing, if you will, the spread, that being a vaccine, was not even in the cards. And I am very happy that that is likely in the cards. And I agree with Akram and Tom in private conversations, but that should not be a reason to loosen our vigilance. Now is the time. We need to work together to protect our caregivers, our workers, our friends, our family in helping eradicate this and get ready for some of the exciting things to come with vaccines and new therapeutics. So at this point, I'll end my initial comments and look forward to questions.
Great, thank you so much. Our first question is going to come from Channel 19, Dan DeRose. Dan, could you go ahead and unmute your line and ask the question? We'll have Dr. Mihaljevic answer first.
Sure, doctor. Thanks for thanks for the opportunity here. I'm wondering if each one of you could go through and give us an idea of what % your hospital beds are occupied at this point. And I know in the spring, we had some of our systems build auxiliary facilities for beds. Have we reopened those? Are we considering that, or are they open? Thank you.
Currently, 450 beds are occupied by COVID patients at Cleveland Clinic. So that translates roughly to about 8 to 9% of our overall capacity. So vast majority of our patients who are hospitalized are not hospitalized because of COVID. Yet we're really worried about the trend. This is twice as many patients, as Akram pointed out. This is twice as many patients as we had at the first peak of pandemic back in March and April. So this is really what we're talking about. We have sufficient capacity and sufficient staff to take care of all Ohioans here in Northeast Ohio. But the trends are what really worries us. And therefore, this appeal to all of us, our fellow citizens, to be vigilant, to follow the guidelines, to hold off the spread of the disease, so that we can adequately not only take care of them those who are infected with COVID, but also those who require other types of services. Those healthcare needs have not gone away. Quite to the contrary. All of our hospitals here in Ohio today, this morning, in Northeast Ohio, have an occupancy right around high 80s to low 90s when you speak about percent, so about 90% occupancy.
So overall, we have about 80% occupancy and have significant capacity. Most important, though, Dan, I think you need to know is that our healthcare systems, all three of us, are getting together, also with the VA and St. Vincent's, coordinating and making sure that we actually load balance all the needs so that we can take care of our entire community. In my 8 years here, I have never seen such cooperation. And I would say to you that the collaboration is really what this community needs and what we will continue to do to provide just-in-time changes so that we can take care of everyone effectively.
Here at University Hospitals, we have, as I mentioned, about 200 inpatients. It's roughly around 9% of our beds. Our capacity is running in the low 80s, about 83 to 84%, meaning that we have room. God forbid if we need more room. Interestingly, unlike the first phase, we're seeing a lower percentage of our patients who are admitted needing to have intensive care unit stays, which is, I think, good because, as you know, we do have some therapeutics now that we didn't have first time around. We're remdesivir, dexamethasone. So we have a capacity, a little better capacity in our ICUs, which are running about 76%. So we are planning, as I mentioned earlier, to be able to get up to 800 patients, which would be close to 40 to 45% of our total bed capacity. And obviously, when that happens, we'd have to be rationalizing where patients and cohorted and rationalizing some deliveries, but we're just not at that point right now.
Okay, thank you. The next question comes from Amanda Van Allen from News Channel 5. Amanda, go ahead and unmute your line. The question is directed to Akram at Metro Health.
Hey, so actually I have two questions. So yes, my first question is for Metro Health. Do you guys know how many staffers you have out right now? Because I believe the other two hospitals have told us already.
We have 60 staff members out at this moment.
Okay, thanks so much. And then anybody else can explain this, but can you guys just talk a little bit more and explain further about the care workers? So caregivers rather, so they are out because of the virus, but you guys say they are not getting it at work. So can you sort of explain how they are getting the virus then?
Sure. So they have contact with family members. They go to church, they go to gatherings and that are tracings, so that's where they get it from. A child, a cousin, somebody they went to a restaurant with, somebody they went to the gym with.
Okay. Thank you. Our next question comes from Anna Huntsman from IdeaStream. Anna, go ahead and unmute your line and ask your question. We can direct this one over to Dr. Majirian.
Thank you. Yeah, so I'm just curious, you keep all talking about these trends. You have capacity now, but these are concerning trends. And I know hospitalizations often lag from when we see the surges of new cases. So I was curious if any of you have a timeline of when, like if this continues, like if the cases continue at this rate, when are we expecting the hospitals to be at capacity or overwhelmed? Like, are we thinking a matter of weeks? Is this by the end of the month? You know, if everything stays the same as it is now, could you talk about that concerning trend?
Well, I could talk about it the best that we can. You know, the issue at hand is that case volumes and new cases vary day to day. As I mentioned before, We had a 4-day period last week where they were cases presenting to our system were going down, and now over the weekend they're going up. So it's hard to say that there's a consistent trend that we could base hard logarithmic information on. But having said that, if we average the increase over the last month, we could see ourselves by Christmas time getting to up to 800 patients, which would be a 4-fold increase in the patients in-house that we're seeing. So obviously we're hoping that doesn't happen, that clear heads prevail. Our biggest concern, I think the three of us offline have shared this amongst ourselves. We're concerned about the Thanksgiving holiday when folks come home and gather with large families. I think if we can double down on masking, social distancing, or perhaps limiting those gatherings to people who, if you will, live in the same, we call it a germ pod every day, then and maybe not have the typical Thanksgiving gatherings, that may help a lot in bending the curve. But I think the governor is right. Masking and social distancing, hand washing, interestingly, they're very primitive and simple ideas developed many, many years ago. But if we can stick to these 3 principles, I think that the general public will see a decrease in the amount of cases.
Our next question comes from Ryan Schmeltz at Spectrum News. Ryan, we're going to direct this question to Dr. Mihaljevic. If you could unmute your line and ask the question.
Yes, doctor. Are you on board with the idea of another significant shutdown of parts of our economy to slow the spread? And if so, is there a concern about what issues could come from the health side from what shutdowns can bring? Example, mental health and financial security?
Well, I think our joint appeal here by all 3 of us is actually to our general public to really embrace wholeheartedly the measures that we are all advocating for, so we can slow down the spread of disease. We know that it works. And an appeal really is to our broader community to make sure that people understand that not right now, the disease is not spreading at the workplace. The disease is really spreading in families, family gatherings, where people start to ignore the measures like masking and social distancing. We have enough capacity to take care of our patients, but what we all share is a hope and a belief that we can slow down the spread of the disease, through that avoid the widespread shutdowns, and really continue to be able to take care of our patients appropriately. It would be a real tragedy to experience a substantial loss of life right as we are announcing a breakthrough excellent news about the new vaccines that are showing a phenomenal efficacy and that are going to soon be available for our patients and our caregivers. This is really the core of this appeal. Back in the beginning of pandemic, we're facing completely different set of circumstances. Now we know how to treat disease better. We are coordinated. All of our organizations are working as one. And we're using all of our capacity. So the real crux of this appeal is to our general public, so that we can avoid widespread shutdowns, widespread disruptions in a healthcare provision, not only for COVID, but also for all other diseases, and that we can get through this together.
Our next question comes from Monica Robbins at WKYC. Monica, if you could unmute your line, and we're going to direct this question to Akram at Metro Health.
Thank you, doctor, so much for doing this. Curious to know the patient population that you are seeing. What is the average age right now? How many are entering ICU and or ventilators? And is this population any different from those that you had seen in the spring?
So I can answer this, Monica, for Metro Health. The patient population, which had been inpatient population, which has been trending younger for a little while, is trending back up older. And the patients we are seeing in the ICU do not have as many comorbid conditions as the earlier phase. So initially we saw a lot of folks with cardiac disease, a lot of folks with lung disease, a lot of folks with kidney disease. The folks today don't have as many conditions as before. So it just speaks to how widespread this is among the population and that it's impacting folks. So I would say to you is that for us, the patient population continues to change from older to younger back to a little bit older again.
Our next question comes from Evan McDonald at cleveland.com. This question, we will direct it to Dr. Majarian.
Hi, Dr. Majarian. I had a question that you kind of touched on before, and I had typed it in before you actually mentioned Thanksgiving, but I was wondering if we could touch a little bit more on that. What you think Thanksgiving should look like for people, or should we just really be trying to avoid this altogether except for your immediate family? What do you recommend?
Well, you know, and I'm sitting here speaking personally as well. I have kids who live in different cities, and I have elderly relatives who want to travel in. And my personal opinion, but only I made this after discussing this with my infectious disease specialists, is two things. Number one, this is not the year for families, I think, to have the large extended family Thanksgiving event with many people in the home. Because I think no matter how hard you try, when you're with family and you're in a home, the safeguards start going down. That means the masking, the distancing, and the hugging. I know it's a terrible thing to say, but it's easier to say now that we know that we have a potential game changer at hand. Not one, but two vaccines and potentially some amazing therapeutics. So I would say to rethink how Thanksgiving is celebrated. Maybe we schedule and we celebrate Thanksgiving virtually. We've learned very well in our business how to do it. Maybe we need to do it just for a month or two more until the vaccines come out. So my advice is to think very hard about if people have been in other cities and other states, and perhaps younger, who may have the virus and not show it, that perhaps testing is done, or at the very least that the masking continues in the home, almost as if you were in a restaurant. So I want people to be very careful and thoughtful about it. I think what will help in a great way will be the notion that there may be, as Akram and Tommy said, there may be light at the end of the tunnel, which we didn't have 7 months ago, to make it a little easier on us.
Thank you.
The next question comes from Lydia Couture. Lydia works for Cranes. Lydia, can you unmute your line, and we'll direct this question to Dr. Mihaljevic.
Yes, thank you so much for having this briefing. I am wondering, the clinic postponed voluntarily some of its non-essential procedures for a number of days. Is this something that you expect to continue to have to do at this rate? And I'm also wondering if other systems are looking at taking similar steps. Thank you.
Yeah, so I'll start from the answer, so to say, from the second part of your question. The fact that Akram, Cliff, and I are here together, it's not just a symbol of our unity. We're really working together as three large systems here in Cleveland area, with St. Vincent's and VA joining us as well. We are really looking to address the needs of our broader community as one combined organization. So everything that we're doing in synchrony with our colleagues, and that includes the postponement of certain procedures that are not urgent in order to free up hospital beds. So yes, we have done it. That is actually addresses a relatively small percentage of our services, but it is a significant ability and opportunity for us to increase our hospital capacity. And we will all be doing, so to say, implement the same measures. We are in daily communication so that we can address the needs of our community. Absolutely, this is a coordinated effort for all of our patients in Northeast Ohio, by all of us.
Thank you. And our final question is from Anna Huntsman with IdeaStream, and we're going to give this question to Dr. Boutros.
Hi, thanks for taking my question again. So I remember at the beginning of the pandemic, many of the hospital systems were preparing surge plans and overflow spaces, like the health education campus at the clinic. I'm curious if there's a need to do this again, and if any of these spaces or overflow plans are being prepared currently.
Well, thank you, Anna. As we said, our plans continue to stay as from the very beginning. We have certain thresholds at all three hospitals and combined on when do we open up the surge plans, such as additional spaces. And that decision will be made between all the health systems together on how do we not only care for, open up these folks, but how to staff it, how to open up these facilities, but how to staff it and care for everyone. So the coordination that Dr. Megarian and Dr. Mihaljevic are talking about is happening in real time every day, including weekends, so that we can decide together when a surge needs to open. Is it going to stay at each specific hospital, or are we coming together as a collective to have a large space? So our hope is not to get to that point in time. I will tell you, our analysis shows that if we don't do something very different, a number of inpatients are going to go from about 470 in Cuyahoga County to somewhere between 1,500 to 2,000 by the end of the year. And that's not really a good place for us to go. So our hope is that with doing this discussion, that we can tampen down that number to hopefully less than 1,000, and that would be incredibly helpful to the community and to the health systems. But it's really up to each individual one of us to do our part.
Thank you again, everybody, for attending today. We really appreciate it. If you have any additional questions, please follow up with your media relations contact at each of the hospitals. We're happy to help you. And in addition to that, we will have a link via Dropbox available of the press conference, so you all have that. Again, thank you so much. Have a good day and stay healthy.
Thank you.
Thank you.